The work that I've done on innovative health delivery models has been almost entirely in collaboration with groups of students. I love involving students in my work. I feel incredibly inspired by them, and in those inevitable moments when the research hits a snag, I find them inspiring and motivating all along the way. And this project actually began with students, and we were very excited by the results that we got. So this research, which began again in 2007, joint with Anil Bhattacharya of St. Michael's Hospital, really was involved exploring innovative health delivery models in the field. And what we sought to do was just go out and look in resource-limited settings at organizations from the private sector primarily. So these are for-profit health delivery organizations that were innovating and achieving breakthroughs of some kind. And we work with students, teams of public health students and MBAs, to profile these organizations both on health criteria and business criteria to understand their models. Our findings, which were issued in a report that was published in 2010 and republished again a couple of years later in the Rotman magazine, our findings focused on just reporting out three major types of innovations that we observed. The first was innovative marketing approaches, and an example would be Dentista do Bem of Brazil, which actually works with private dentists that have established dentistry practices to offer subsidized care, subsidized by the government, subsidized care to high school students and young people to get them in the habit of getting preventative dentistry early in their lives before they had significant problems. This benefited the dentists because they would have patients for life. It benefited the government because good dental care, good oral care is associated with better employment prospects and fewer health problems later in life. And of course, it benefited the patients. So that would be an example of an innovative marketing practice. A second area of activity which we observed was innovative operations. An example here would be KMET, which in Kenya does midwifery training in the field, introducing medical device technology into communities for better care at delivery, maternal and neonate care. It's been very effective as well. And a third example was innovative financing models. Here we observed Vision Spring, which is a kind of pioneer in actually providing packaged eyeglass models to entrepreneurs in resource-limited settings. And the basic framework here is that, for $5 or so, as a small entrepreneur, you can buy a little bag of tools that will allow you to build a set of eyeglasses, which is, of course, a non-invasive health device, and improve the health of people in rural communities. That's been very effective, too. So this is just some examples of the work we've done on innovative private sector health delivery models. And the ideas that we developed here has led to subsequent work that I'm now beginning on endogenizing organizational form. So I'll talk about that separately.